What's up, everybody? Welcome to this will be episode 3 of Teen Talk with Livi J. So like I promised some people, we are having our mental health discussion. I am super excited. And yes, so I have one person from the original video, and then I have my very special god sister here too. I'm super excited. So they're gonna come in here and tell you their names because I'm not gonna tell you their names. And you already know about Madison, so I'm gonna ask Lauren to say what you do because that's why you're here. And yeah.
Yes, my name is Lauren, and thanks to Olivia, I will be speaking a little bit about mental health and with teens and kids, basically. I am a mental health therapist currently at a private practice, and I work a lot with kids and teenagers too, and young adults. I've been a therapist for about 6 years now. So I mainly work with kids because I really enjoy it. It's you see different things every day. It's never boring. So I love that part of the job. But so just any questions you all have, just let me know and we can talk more about it.
Awesome. Okay, so we're gonna start with the simplest thing that I can start with, which is just a simple. I'll say something on it, and then I'll ask Maddie, and then we'll ask you to say something on it, Lauren. But okay. What is something that messes with you mentally? So I know that in the sense of, so you have depression and things of that nature, but what, as a teen, Maddie, what do you see causes those things?
I think family and like your personal life, what you see as a child is like what you think is right, even though it may not be, but you don't know any better because you see it every day.
Right. I think that, and then I think it's I've always been the person to play the big brother, big sister, mom role. So I've always been been captain, save a person. I've always swooped in and saved a person. And so when you're so busy helping other people, you're letting all that negative energy come in, but you're not putting any out. Or you're letting all that negative energy come in and you're not finding a way to release yours and somebody else's. So then it becomes more of a issue of I'm holding my burdens and somebody else's burdens and I don't know what to do.
That's right. Yeah, that's so
now,
true.
As a counselor, what do you see more?
I definitely agree with you. Well, I agree with you both, especially with you all being so young too. If you trying to save other people and like you said yourself, trying to be captain save, anybody, your friends or family, whoever it may be, if you're holding that stuff in, and not having an outlet, whether it's sports or just having someone to talk to, your parent or, an older sibling, it can also cause, depression or anxiety because you're not letting that out. If there's no safe outlet, basically. So I see that often. A lot of kids don't know that they're doing it, teenagers maybe. So knowing that you are, like being aware that you are trying to save those around you, friends or whatever it may be, that's the first step in my opinion. So knowing that you're actually, doing it, but also the next step is how can you make it so where, you're also saving time for yourself as far as self-care, which is very important, even as kids. I think parents don't think self-care is as important, of course, as it is for adults, but it's just as important in my opinion. So, but I agree with you.
So what are most of the mental health things that you see from when people come in, or when kids and teenagers come in and out the office? What are the things that you see the most?
I see a lot of anxiety. Actually, more. Okay, so my last 2 jobs, I worked with at-risk kids, and when I say at-risk, I mean like juvenile justice, going to detention centers, hospitals, things like that, group homes. So my current job is more like a lower level. So I see a lot of less intense things like anxiety, depression, but mainly social anxiety. And that basically is at school, in public gatherings, groups. For instance, they could not do what you're doing, Olivia and Maddie, because they wouldn't, feel comfortable in the setting, of course, too. So definitely anxiety and depression, I would say.
How do you have them deal with anxiety? Because I know people who have a phenomenal way of masking all of these different things, like high functioning depression. I have seen people deal with that And then me being the person that everybody comes to, I have dealt with it where I've just high functioning. I just keep moving. And I have days where I don't want to get out the bed and I am super upset and I do not know why. How do you have people, how do you have the people that you counsel deal with that?
Depending on, well, I'll say the kids and the teenagers and young adults. Have you heard of mindfulness before? You or Maddie? Basically trying to, it's like meditation in some form, but thinking of ways to like change your thoughts, being more aware of your feelings and your emotions. Of course, I think we all have those days too, Olivia, when we're not, feeling that day. If it's raining outside, we're just, we're not sure why we don't want to get out of bed, basically. But trying to, encourage ourselves and motivate ourselves, which can be very hard sometimes too. I definitely understand that. But just giving them different like coping techniques to use, like things, whether it's saying positive affirmations to themselves every day, like I can do this, school's not that hard, it'll be a great day today, whatever it may be. Just trying to talk positive, to themselves, which can be hard, but of course it can be done too. But sometimes it's easier said than done. So it just depends on the person and the kid and the teenager. So yeah, just depends, honestly.
We touched on mental health in the first episode, didn't we, Maddie? We did. Yeah, I'm pretty sure we did, and we had a discussion about everything that we could think of in mental health. And Maddie, you mentioned something about affirmations.
Yeah.
I think, didn't you? I don't.
Yeah, I did.
Yeah, you mentioned something about affirmations, but something that was really a big topic when we talked about mental health was how can you label depression? Because we had me, Madison Charlton, and Jonathan, the boy on the show, and he was like, we were all discussing and we kept saying this and that about depression, and then Madison Kelly brought up the point, well, how do you go about finding out that you are depressed? Because everybody has those days where the regular symptoms are just, everybody has those days. And so then she went into the maybe depression isn't a mental illness. So how do you feel like people how do you differentiate just not feeling like doing anything with actually having depression and anxiety and things?
So I'm going to read you a little something because it's a very good question. So occasionally being sad or feeling hopeless is a part of every child's life or teenager's life. However, some children feel like sad or uninterested in things that they used to enjoy or feel hopeless about things can actually be more serious, I guess you would say. So if you feel like the sadness or hopelessness is like every day or more often than usual, like you can't complete certain tasks, like let's say, for instance, Olivia or Maddie, you're doing this series, and for like 3 or 4 different in a row, you're like, you know what, I'm not feeling it again. Like it's the second week I'm not feeling it. So if you're like noticing a pattern and like it's not like, letting up, it's not like once every 2 weeks, it's like literally every other day, then most likely it's probably depression. If it's happening more often, usually, or if it's interfering with your mood, you're more irritable. Usually depression it shows by being irritable and just not interested basically in activity. So if your grades are dropping, just, all of a sudden you don't feel like talking to your parents like you used to, you're like cussing, not cussing. Well, actually, yes, cussing or fussing out people that, you wouldn't do before, snapping back. If it's happening more often than usual, then that's the difference between, you having a day than like most likely depression.
So what do you think specifically, like what life event can cause this? And actually, Maddie, I'm going to ask you this question too, because we could all see different things, but what life events do you think causes depression, anxiety, and the leading things that most teens have?
I think that bullying, it definitely plays a part in depression and anxiety. Stress put on you by parents, family, teachers, not having an outlet, like you said, just all that.
Yeah, you're exactly right. I agree. Definitely I see a lot of kids in my office and my last job too with bullying, more than I would have liked to see. And honestly, the bullying of course causes stress, anxiety and depression, and even, self-harm also, whether it's thoughts or actually, acting on the self-harm. But yeah, I agree. Family, whether it's parents who are divorced or, no longer together, or, parents who put too much stress on you, the kid, relationships, like, the boyfriend, girlfriend in high school and middle school. Parents may think that, it's puppy love, but honestly, especially females, actually, males, not so much I've seen, but like young women your age, take them more seriously, of course, too. So in grades, if they're pressured into making all A's and B's and, like, they bring home a C or a D, that also could put more pressure on the kid as well. So, and also environmental factors such as, your parents can't pay the rent, or, the lights, the power went out, basically. You don't have food on your table. Like, that by itself causes, depression, because you don't have what you need, of course. So, I've seen all those things, sadly, but I have.
So I had somebody, actually, I was talking to somebody, and they were like, well, I have a question. And they probably worded this in the most educated way that they could. They said, why is there such a stigma around mental health care, specifically for African Americans and youth?
Okay. The stigma, I would say, probably because I want to point this towards African American boys, men, because a lot of times, well, we can say both. For boys and girls, we see our parents and grandparents not take mental health seriously, in my opinion. And so we automatically think, that's honestly, for white people or for other people. It's not for us, because, we pray about it. We go to church, every Sunday or whatever it may be. We talk to our pastor about it, basically. And so, again, having that holistic approach where you're, of course, please pray, go to church, talk about it with your family, your pastor, but also seek mental health if you can. But of course, kids can't do that because, of course, school counselors, yeah, that's fine. But their parents have to take that first step, like, okay, let's talk to your doctor about it first, set you up an appointment. But and also in schools, you see, and I'm sure you can see this too as well, our young Black boys acting out in class, maybe are fighting a lot, and then being sent to the principal's office or being suspended for like 10 days, but they're not getting the help, and girls too, probably fighting as well. They're not getting the help that they need. They're being suspended, coming back to school, but nothing was solved, basically, or resolved in that situation. So I think it has a lot to do with it as well. Parenting, in my opinion, honestly, is the main thing.
So I've seen something on, we talked about this in the first episode. We talked about a lot of stuff in the first episode, but we talked about this thing that we've all, or most of us, have seen on TikTok, and it's literally this TikTok where it's like Black parents be like, oh, so you say you depressed? Go to press them dishes. And then I talked to my mom about it, and my mom said, well, basically, if you think about it, even dated back to slavery times, we were always taught to shut up, go along with it, push it down, pray about it, you'll be okay, keep moving. We're always taught that don't nobody care, you're going to have to be stronger than what this is. I think that plays into it a lot.
Yep.
It's kind of like true. It's generational mindset. So you start with years and years and years ago, you're taught this, and then you keep passing it down. And actually, in episode 2 that I have not posted yet, Jesus, in episode 2, we talked about how a lot of things can be passed down from generation to generation. You don't even know. Mental health things can be passed down. And we also talked about racism can be passed down from generation to generation, or racial bias.
Yeah.
Things of that nature. So my next question, because I'm not going to keep you long, but how can a youth get help? Because it's hard for us to go to a counselor that we feel like doesn't care.
Yeah.
Because I know 400 kids in one school to one counselor. And that counselor is over a whole bunch of different things at school. That's not really helpful. And then we go to our friends, and our friends, kids of this day and age are going to laugh because you say you're depressed, because they're going to think it's funny, because they think everything is funny. And things of that nature. So how do you suggest that a teen or a child gets help?
I would say, I'm looking up this hotline number as well, because I didn't save it earlier. Let's see. Okay. So there are many hotlines for teens, and actually they work. Well, some of them do anyway. I had one client maybe a month ago. She called. I wasn't available because I don't work on weekends, but she called this hotline for kids because she felt like she was going to harm herself. and they actually sent someone in their area from the hospital to her house that night. So, of course, some kids may not feel comfortable with having someone come to their home, you know, in the middle of the night. I understand that too, but I would say, actually, I can send that out to you, Olivia, as well, the hotline number as well. But there are different places here in Greensboro, downtown Greensboro, with resources for, of course, kids and adults too. But I would say talk to your parents first. And I know, like you said earlier, some parents, especially Black parents, are more, you know, I don't believe you. You're trying to get out of washing the dishes, or like cleaning your room or whatever it may be. But talking to your pediatrician, like your actual doctor, and they can be the ones to actually set you up with an appointment with a actual either psychiatrist or a therapist, honestly. So your actual pediatrician can be the first step in getting help with whether it's depression or anxiety or, you know, anything that you're going through mentally. So in my opinion, that'll be the first step, is to seek your pediatrician.
Okay, so those are there any other resources available? Because I know that there are kids who just won't talk. Like I'm friends with some of them who will literally only talk to me, and if I'm like, go talk to your parents, they're like, I'm good, I'm going to talk to you, but nobody else. What other resources are available for them?
Okay, so as far as locally, into this one comes up right now, but as far as locally, do you think your friends or your peers, Olivia, will, or Maddie too, feel more comfortable with talking to someone, like actually calling a number and having someone give them advice over the phone? Do you think that would be more helpful for them? Okay. So there is, I'm not too fond of this particular resource, but they have helped those that I know of in the past, but Monarch here in Greensboro, and they help, of course, kids and adults too, but they have, of course, their own helpline for mental health for kids as well and teenagers. So Monarch here in Greensboro, there are actually many all over the country, the Monarchs. So that could be one resource I know for sure that could be helpful. And as far as there is one called teenlineonline.org. They have a number as well, but sadly there aren't many like safe helplines for kids, because a lot of them want the parents to also be involved as well. So most likely what will end up happening is, you know, who's your parent? They have to be on the line with you. And to me, that's not fair, because it should be, you know, confidential, I guess you would say. But definitely I know Monarch would be probably the best option I would think of right now. And I will send you the other two that I can't find right now, the other helplines that could help possibly.
All right, and last question or two. What recommendations can you make for anybody who is dealing with anxiety and depression at home to make sure that it doesn't get worse while we're stuck in the house in quarantine with the coronavirus? Because I know that you can lose your mind staying in the house with your mother or your sisters, brothers, cousins, friends, just the whole family, because Black people like to stock up in house anyway. Anyway, how could you, somebody who's already dealing with and struggling with mental health, how can they kind of, I guess, stay normal during this time?
I would say definitely the advice that I've been giving my clients during this time is keeping yourself busy. And I know that sounds very, you know, like there's nothing to do, but being active, whether it's, of course, being outside for one. A lot of kids are being cooped up in the house. I don't know why, but being outside, just being out there playing basketball, riding your bikes, getting some vitamin D is very important right now. Going to the park if you can, walking the trails, going hiking if you're able to, of course, the mountains. But just being outside, doing something, you know, active with your pets, especially because they're bored too, I'm sure. You know, your siblings, whoever, maybe your parents, and also eating healthy. Like it's so easy right now to eat snacks all day, whether it's, you know, ice cream, chips, whatever it may be. It's so hard to like eat healthy because, of course, you know, boredom leads to watching TV and eating snacks. So I definitely would recommend, of course, for those families who may not have the, you know, the actual resources to buy fruits and vegetables, you know, but I guess being very creative maybe, but trying your best to, you know, eat some fruits and vegetables if you can, making smoothies or like healthy, you know, alternatives, I guess you would say. And also sleeping well, because honestly, if you're like, of course, I know now, and it's almost summertime too, going to sleep around 2, 3, 4 o'clock in the morning. Trust me, I know, because these kids tell me every day. So going to sleep late at night or early in the morning, really getting up about 1, 2 in the afternoon, and then doing your work, can definitely be a cycle because it'll be hard to get out of course, when school starts back in the fall anyway. So trying to get that sleep if you can, it's going to be hard, I know, but trying to wear yourself out during the day by doing something active and then like getting sleepy, hopefully going to bed around at least 12, 1, not too bad, I guess you would say. But, and just being creative, like you, for instance, Olivia, you and Maddie both, you're doing something that you're very interested in and you love. So finding new activities to do and in the house, writing blogs, making videos, of course, positive, hopefully, reading a book that you haven't read in a while or, but yeah, so that keep your mind off things that may bring you down or may, make you depressed too. So I know it sounds very, cliche, but hopefully.
Yeah. So everybody, since they're trying to stay busy, they're using their phones, and when
Yes.
everybody's time and Instagram and Snapchat and TikTok is full of the crime, the police brutality that we're seeing more because we're stuck in the house, so we're going to scroll and we're going to see it if somebody posts it. We're stuck in the house. Do you have first of all, do you have a large demographic of African Americans who come in with mental health issues?
Honestly, I think I see more of Caucasian. I do see, of course, a handful of Black kids, Black families, but I see more white people, honestly, this time. Now, my last job, it was definitely all Blacks, if I'm not mistaken. But
so how do you have them deal with things that they see? Because it feels like, there's a war on Black lives, and we've seen all these Black Lives Matter and this, that, and the third. How do you have them deal with it? Like, I know specifically most of my friends are Black boys. I don't know why I get along with boys better, but most of them are Black boys, and so they're scrolling and they're seeing all these things where it's a war on people who look just like them.
Yeah.
How do you have your the people who come in and see you, how do you have them focus on something different or not be so negative when they see that? That's difficult.
So I tell them, of course, to feel what they feel, like be angry, because that's expected for you to be angry, and encourage them to not let that get to them to the point where they feel like they have to go out and retaliate, I guess you would say, or get back at the white person or the white man. But a lot of them, of course, they are angry and they're confused. And I say, your feelings are validated. Like, you deserve to be angry and confused and, just upset with the world, because no one is trying to protect you. But I also give their parents also, if their dads and the moms, are in their lives, I would just let them know that, they need extra love right now. Like, you have to protect them the best way that you can, even though you can't be with them all day, of course, in school or out in the park or, outside whenever on their bikes. But teaching them, like, okay, this is what you do when this happens. And of course, and a lot of times that doesn't even work now. It does not. So, but giving them the love that they need, the encouragement, continue to have them affirm to themselves, like, you know what, I'm loved, maybe not by the next person, but I know that I'm worthy. And no matter what happens to those around me, I will do everything that I can to be safe. And, so it depends on the person and the kid, of course. But I definitely continue, me personally, I encourage the parents to be more active in the kids' lives if I can. And to just, encourage them to think about their future, of course, and like what they have, coming up, and just validate their emotions first. Like, don't tell your kids or, your friends, like, don't be angry. It's not a waste of energy, because most likely that's not going to help anyway. And so we're all angry at this point. We are. So just encouraging them to not retaliate and just try to see the positive in what is going on right now, like in other things in the world, which is hard. I know it is, especially right now. But that'll be my advice. Again, it just depends on the person. It does. So, yeah.
All right. Last thing, Maddie, I want input from you on this as as a teenager, what would you like to see from the people around you when it comes to dealing with mental health? And by people around you, I don't mean kids, people our age. I mean like adults, big brothers, big sisters, aunts, uncles, moms, dads, grandmothers, all of those wonderful people. What would you like to see from them? And Lauren, what do you recommend for parents and people who are older to do when a child is depressed or has anxiety or something like that?
Okay.
Probably since they are older, they'll have more influence on the child. Affirm them, like try to have fun with them, talk to them. If they like, make sure they trust you. Try to play a game with them, like just make sure they're feeling the best that they can, so they won't so nothing will escalate to like something worse.
And I would say, as far as recommendations to parents and just caregivers for kids, don't just sweep up the kids' feelings, emotions under the rug. When they say, I'm not feeling well, I'm feeling really depressed. I feel like I'm having bad thoughts as far as like suicidal thoughts, etc. Definitely don't take it seriously, because if you don't, of course, something bad could happen. But I'll recommend parents to sit down and talk with their kids, even though it may be uncomfortable. I get that, but thinking about the consequences of of what could happen later on, honestly, could be very detrimental to both, you and the kid. But seeking help, like I said, pediatrician, probably the first step. And then, of course, they will make the referral to the either psychiatrist or the therapist. Medication is not always the answer, like ADHD medication, or depression medication, anxiety, etc. Of course, it's definitely helpful in some cases when it's very severe. But therapy, in my opinion, is the main, is most helpful from what I've seen so far. So starting with therapy, and then if it needs, if you need to move up a step, then maybe medication. But just listen to your kids, sit down, talk to them, because honestly, it may just be you not giving them enough attention. Like I said, you got 5 or 6 kids. I get it. So that's a lot of work. But spending, time equally with each kid could mean a world of difference. So being more attentive to your children and listening to them, like not just, I hear you, but like I'm listening to you, and I hear what you're saying too. So could make a big difference as well.
Do you think if the parent is going through something, if the parent goes to see a counselor and then they put their children in counseling just as a, I guess for safety precaution, do you think that's helpful if you start early, even if there's nothing wrong?
Well, how old is the kid? Sometimes it just depends on age.
7.
Okay, yeah. If the child has also been exposed to anything like, violence or, whatever it may be in the home, I would definitely say yes. If they're not showing any symptoms, you could, but not sure, how effective it would be. But if they've been exposed to anything in the home with the parent, then I would say definitely yes. So it just depends on what's going on, honestly.
All right. Well, that's all the time that we have for today. Thank you so much for coming on here.
You're welcome.
I'm
No
excited.
problem.
Thank you, Lauren. Thank you, Maddie, for your return.
No problem.
Nice meeting you, Maddie. Good seeing you,
Nice
Olivia.
meeting you too.
See you too. Hopefully, I'll see you soon in the flesh.
Yes, I hope so. Y'all be very safe. Please do.
You too.
We will. You too.
Thank you so much. I appreciate it. Thank you for having me, Olivia.
Thank you for coming.
No problem.
Bye.
Bye. See you later.